The death of a baby is a traumatic event for any family and a tragic loss for a community. Sometimes the death is caused by the baby being born too soon or too small. Sometimes the baby has some birth defects that are incompatible with life. But sometimes babies are born healthy and die unexpectedly and without warning. These deaths of seemingly healthy babies are not a rare event. In fact, they are the third leading cause of infant deaths and the leading cause after the age of 1 month. These deaths are particularly devastating because they are sudden and often unexplained. These sudden unexplained infant deaths are often labeled as Sudden Infant Death Syndrome, or SIDS. Because of their significant impact on our community, we're going to take a special look at SIDS and other sudden unexplained infant deaths on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to take an in-depth view of the third leading cause of infant mortality in the first year of life and the leading cause of deaths of infants from 1 month to 1 year of age. That is Sudden Infant Death Syndrome and Sudden Unexplained Infant Deaths. Joining me in this conversation is Dr. Andrew Baker, who is the Hennepin County Medical Examiner. As Medical Examiner, Dr. Baker is responsible for the overseeing of the death scene investigation and post-mortem examinations of the sudden and unexplained infant deaths in our community. Andrew, welcome to our program.
It's good to be here, thank you.
And you're the first medical examiner that we've had on, and it's an interesting occupation and job. Tell us a little bit about being the medical examiner. What is the role of the medical examiner in Hennepin County?
So under Minnesota statute, my office is charged with investigating any death in the county that appears to be unnatural or unexpected for any reason. I think the general public thinks most of what we do is investigate homicides and murders because that's how we're portrayed on CSI and other popular television shows. In reality, most of the deaths we investigate turn out to be accidents or natural deaths that are just completely unexpected by the person's medical history, comes as a complete shock to their family and friends, and that's when we come in, investigate the death. In many cases, we perform an autopsy to ascertain why that individual died. People think that we're a law enforcement agency, which in fact we're not. We're a completely independent agency. I would say we have just as big a footprint in the public health camp as we do in the public safety camp.
And explain that a little bit. Why in the public health camp and is the safety camp?
Well, for example, we're noticing a large uptick in our heroin deaths in Hennepin County right now. Last year we had about 10 times as many as we were seeing when I went into this line of work 15 years ago. That's a public health issue. If my office weren't performing those autopsies, if we weren't doing the appropriate toxicology testing, these deaths would go missed. Those are preventable deaths. We also take a very strong look at suicide deaths, which are increasing not just in Hennepin County, but statewide and nationally as well. I think suicide is a public health issue. It's something that I think needs to be talked about, thoroughly investigated, properly certified. Certainly if you look at things like infectious diseases, those that end up being fatal, the medical examiner has a very important role in making sure those things don't get missed. For instance, the influenza pandemic that we could have had several years ago. Medical examiner has to be prepared to investigate and properly certify those deaths.
So you just got yourself invited back to several more episodes on this program.
Perhaps I did.
But the role of the medical examiner is to really look at those unexplained deaths, the things that occurred, and that's why it fits in so well with sudden infant death syndrome.
Yes, absolutely.
These sudden unexplained deaths. So tell us, what is the definition of sudden infant death syndrome?
So the definition of sudden infant death syndrome, or SIDS, has actually been around for several decades now. And essentially it's the death of a baby up to 1 year of life that remains unexplained after a complete autopsy, after an examination of the death scene, and after a review of the child's clinical, medical, social history. If none of those things explain why the child is deceased, then the case can be regarded as sudden infant death syndrome.
Now there's a new term that's come out in the last 5 or 6 years, sudden unexplained infant deaths, SUIDS. What is that?
So sudden unexplained infant death, or SUID as we sometimes call it, really represents a change in the way that medical examiners are looking at the way these infants have died. If you look at the history of SIDS and the transition to the terminology SUID, what you realize is the more we go back and look at the scenarios in which these infants died, the more we realize that how much the environmental factors played a role in the infant's death. And by the environmental factors, I'm really talking about things in the child's sleep-related environment. And so in some offices like mine, this mindset has transitioned to the point where we don't use the term SIDS anymore at the Hennepin County Medical Examiner's office. I don't think I've put the term SIDS or Sudden Infant Death Syndrome on a death certificate probably for 10 years now. If the death remains unexplained, we sign it out as Sudden Unexplained Infant Death, and we leave the manner of death undetermined, which means we really don't know. But about 50% of the cases we investigate where an infant has died in a sleep-related environment, we're confident enough that the child accidentally suffocated or asphyxiated that we actually call those deaths accidents. And we explained the child died of positional asphyxia because of the bedding they were in or other circumstances. The default over the previous decades was to assume that SIDS was a natural death. It wasn't preventable. There were no risk factors. The chances it could happen again to any one family were infinitesimally small. And we realize now that that's not really true.
So if we didn't look at these, if we didn't examine it, would leak like it would be just out of the blue, the baby died. But as we look at it and examine it, do the death scene investigation, look at all of the situational things, we're recognizing that about half of those can actually be explained by, like you say, one of the environmental factors.
That's correct. And when I say half, that's based on Hennepin County data and our retrospectively looking at cases we've investigated. There are offices around the country that will certify many more of these cases proportionally than we do as accidental type deaths. On the other end of the spectrum, there are offices around the country that still regard almost every infant death as SIDS. Some of that is philosophical, some of that may simply be that they're not investigating these deaths as thoroughly as they could. It's one of the real problematic areas in all of infant death investigation is we really don't have standard protocols and procedures across the country. And so when you compare SIDS rates or SUID rates from one state to another, one county to another, it's very rare that you're actually comparing apples to apples.
Well, that raises one of the questions that I have is, does SUID or SIDS, unexplained death, infant death, vary from various parts of the country?
Yes, the rates can vary wildly from one part of the country to another. Now, some of that may be explained by social factors, racial factors, economic factors, but the wild card in all this is some of it is also explained by the coroner or medical examiner system in that jurisdiction, using different terminology or not even thoroughly investigating some of those deaths.
Do all states do the death scene investigation? All jurisdictions do that or not?
No, not all jurisdictions do death scene investigations. Not every jurisdiction defines a death scene investigation the way that another jurisdiction might. And to give you an example as to what I think should be the standard and what we do here in Hennepin County, I've got trained medical legal death investigators that work for my office. They're very seasoned individuals that know how to work with families, even acutely grieving families. And one of the things that we do is we actually go back to the scene where the infant was found deceased or unresponsive. And my investigators will use a doll, and they will have the parents or the caretakers place that doll in the position in which they remembered the child last being alive. They'll place the doll in the position where they found the child deceased or unresponsive, and we document that photographically. Because in virtually all of these cases, the autopsy turns out not to find the cause of death. By all anatomical features, these appear to be perfectly normal, healthy children. It's only knowing what you found at the death scene that really helps you understand what happened to these children. And without trained death investigators who know how to work with the caretakers, you're not going to get that critical piece of information.
Right. Well, I want to talk a little bit about the numbers and the trends that we're seeing, and then the causes that you're finding on your death scene investigations and your postmortem exams. Sure. But first, we need to take a little break.
Okay.
We'll be back right after this message.
full life, measured in SIDS, starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Welcome back. We're talking about sudden unexplained infant deaths with Dr. Andrew Baker, the medical examiner for Hennepin County. Andrew, let's talk a little bit about the numbers. I mentioned in my introduction that SIDS is the third leading cause of overall infant deaths and the most important leading cause of infant deaths in from age 1 month to 1 year of age. Why does it become the leading cause of death in that last 11 months of the baby's life?
Well, when you get into that 11-month period after the 1 month mark, you don't see the premature babies, you don't see the children with the congenital heart defects and other complications in that age population. So when you look at what the medical examiner is seeing, we're really seeing infants that by all external appearances appear to be healthy during that time period. After you get past the 12-month mark, we don't really consider SIDS or sudden unexplained infant death anymore, because by definition you're not an infant after the age of 12 months. And really by the time you get to the age of 12 months, we're talking about children that are very mobile. Mm-hmm. And so a sleep-related environment death really doesn't become part of the equation. The chances of a sudden unexplained death in childhood after the age of 12 months is dramatically lower than the risk to kids in the infant group.
Mm-hmm. So I suspect that's actually from 1 month to 4 or 5 months is when most of the SIDS deaths occur?
Yes, they actually, classically they peak at about the 3 to 4 month mark. As children become larger and more mobile, the number of deaths that we see in the infant population drops off. And of course, they become larger and more mobile as they grow so rapidly.
Mm-hmm. Now, I've got a couple of slides looking at some of the data that you've collected here. And let's look at the first slide, which shows some trend lines. Could you explain what's going on here? What is that top red line?
So the top red line you see here, and this is data from the Centers for Disease Control, is all of the infant deaths that you and I have been talking about for the last several minutes. So SIDS, accidental suffocations, any death on that spectrum being investigated by medical examiners and coroners is illustrated on the red line that you see here. Okay. And the important trend on this red line is if you look at the period in the 1990s, the number of total unexplained infant deaths we were seeing in America plummeted dramatically. And that corresponds perfectly to the institution of the Back to Sleep campaign, which was launched in the 1990s, where pediatricians, primary care physicians, and nurse practitioners knew to counsel new parents that your baby shouldn't be sleeping on her stomach, she should be sleeping on her back. Those recommendations were based on very good data coming from other countries where they had already started to see their SIDS rates go down. So that's what you're seeing on the red line. From my perspective as a medical examiner, the problem with this red line is after the late 1990s, this line has gone flat. Despite whatever efforts we seem to be making, we haven't made additional dents in the total number of infant deaths we're seeing. Mm-hmm. And again, from a public health point of view, I think that's a problem because so many of these deaths at some level are preventable.
Mm-hmm. Now, the second line right underneath it is the sudden, the SIDS, the unexplained, the sudden infant deaths that we can't explain, right?
Correct. In fact, you see several other colors below the red line. The line that you mentioned is the SIDS line. You can see the rate for that has gone down. Correspondingly, you can see the yellow line at the bottom of the chart, which is accidental suffocations and strangulations in bed, going up. And part of this just represents that sea change I mentioned among medical examiners, where we're regarding fewer deaths as SIDS, we're regarding more deaths as actually being accidental suffocations. So some of that is just representing the diagnostic shift. Mm-hmm. Again, the most important thing about these data is the red line at the top. It doesn't really matter what we're calling these deaths so much as we're not making a change in the number of these deaths that keep occurring every year.
Yeah. So we made a big progress in the early 90s. It's really flat, so we need to do something more because it's still a significant number of deaths. Well, let's look at the second slide that I have, which really looks at sleep-related deaths. You know, it says by scenario. What do we mean by this, and what are we seeing in this, and explain what the difference is between the blue and the red lines here.
Sure. So the data you're looking at actually came from a 5-year study period in Hennepin County. Hennepin County formed a multidisciplinary team that wanted to address preventable deaths in this age group. And as part of that team, I was tasked with answering the question, well, what is the magnitude of our problem? How many babies actually were dying in Hennepin County in a sleep-related scenario. So you see 5 years worth of data on this graph, and in total there are 84 deceased infants represented on this graph. And hopefully many people would find it shocking that we had 84 sleep-related deaths in a 5-year period just in our county. You can see that the two highest peaks by far on the left side of the chart are children who were sleeping in an adult bed with other adults. The blue line represents those cases that we simply called accidents because the scene was so compelling. We said, we think this child accidentally suffocated. The red line is those deaths we certified as undetermined, meaning that for whatever reasons, maybe there was limitations with our scene investigation, the caretakers couldn't remember. For a variety of factors, we certified the death as undetermined in manner rather than accident. If you look at all the scenarios represented on this chart, you can see that a disproportionate number of deceased infants die sleeping in adult beds. It's extremely unusual to have an infant die sleeping in her crib alone in a perfectly safe environment, which of course is where infants should be sleeping.
Right. Well, and that's where we'll get to some of the recommendations. So that sleeping in an adult bed, whether the adult is there or not with the baby, is not a good thing.
Correct. That is not a safe sleeping environment. We know that from our own data. We know that from very well done studies from several countries around the world. And it's very clearly the position that the American Academy of Pediatrics has now taken. You know, they have a very nicely worded position statement about where babies should be sleeping. And they should be sleeping on their backs, on their own safe sleep surfaces, in the same room as their caretakers, but not in the same bed as their caretakers.
And I notice in some of the other things in here, excess bedding, soft bedding, it's all of the things that are in the bed or even in a crib, if a baby does die in a crib, with bumpers and blankets, anything around the baby that could suffocate the baby. Is that the issue?
Anything that's soft and unnecessary really has no business being in the crib. And I wish I could tell you how many tragic cases I've seen where well-meaning parents took an adult pillow and put it in the crib or the bassinet thinking they would make that surface softer for their child and more comfortable, when in fact they're inadvertently making it much more dangerous. And I've seen many, many infants suffocate in environments like that.
Okay, well, I would like to talk a little bit about what people can do, what people need to know about to prevent sudden unexplained deaths, but again, we need to take another little break.
Okay.
We'll be back right after this message.
In 1977, in Johannesburg, South Africa, an 8-year-old boy picked up the game of golf from his father. By the age of 9, he was already outplaying him. The odds of this gentle lad winning the Junior World Golf Championships at the age of 14, 1 in 16 million. The odds of that same boy then making it to the US and European Pro Golf Tours, 1 in 7 million. The odds of the Big Easy winning the Open Championship once and the US Open Championship twice, 1 in 780 million. The odds of this professional golfer having a child diagnosed with autism, 1 in 88. Ernie Els encourages you to learn more at autismspeaks.org/signs. Early diagnosis can make a lifetime of difference.
Welcome back. We're talking about sudden unexplained infant deaths with Dr. Andrew Baker, the medical examiner for Hennepin County. Andrew, are there variations in Minnesota from county to county, urban to rural, related to sudden unexplained infant deaths? Are rates higher one part of the state over the other?
Yes, rates do vary from one part of the state to another and from one population to another. And there's a variety of reasons that might be true. One of the reasons, as we already discussed, is simply differences in classification by medical examiners and coroners and the extent to which these deaths are being investigated. Even allowing for that, it's clear that some communities, some ethnicities are more affected by sudden infant death than other communities. Now, some of that may be for historical reasons, some of that may be for cultural reasons, some of that may be for socioeconomic reasons, some of that may be that the public health message is just getting to some communities better than it's getting to other communities.
So when you do an examination, or your staff, you do the death scene investigation and then you do the autopsy, what are the things that you're finding in those death scene investigations? You talked about the doll and the bed clothing. Do you find other things when you're examining what's going on? Air temperature, sanitation within the house, smoking within the house. I mean, because I know SIDS has been related to secondhand smoke in some cases, infectious diseases. Are you finding other things in those investigations?
Yeah, there's a huge variety of things, many of which you just mentioned, that my investigators specifically look for at every one of these death scenes. We actually use a multi-page checklist that was developed by medical examiners in the CDC to record many of the things you just talked about. So we actually do assess the temperature. How swaddled was the child? What's in the child's sleep environment? Is there evidence of drug and alcohol use in the home? What is the child's medical history? Are there other children in the home? Has there been a previous baby death in the immediate family or the extended family? So all of those things get asked and addressed, and where appropriate, even documented photographically. What we often find at these scenes, and I find this particularly tragic, is there is a perfectly acceptable place for the child to be sleeping in the home, a government-approved crib or bassinet, but the bassinet is being used for something else other than infant sleep. Maybe it's full of clothes, maybe it's full of a variety of other things from around the house, and the caretakers have taken the child into their adult bed with them instead of using the crib that's there. And so those are very sad cases when you see that. Now there may very well be families that can't afford that crib or that bassinet as well, and so because they don't really have many other options, they're co-sleeping in an adult bed. And so all those things get looked at by my investigators when they're at these scenes.
Okay, and when we looked at the numbers, you saw the decline in the 90s with the big back to sleep effort, and you have brought another slide that I want to put up on the screen about mothers' understanding about that. Explain what this slide shows.
So the chart you're looking at here is from data that's only a few months old. This is the National Infant Sleep Position Study data that was just published, and this is data that comes out every several years where thousands of mothers are surveyed about the positions their babies are sleeping in. The interesting thing about the study that was just published is for the first time they started asking the mothers what advice they were getting from their primary care practitioners about where their baby should be sleeping. And I was kind of shocked to see that more than 50% of new mothers could not recall ever having had a conversation with their primary care practitioner about whether bringing their baby into an adult bed with them was a good idea. Now, I don't know if this is because we're dropping the ball on the medical side and not conveying this information, or perhaps new parents are hearing the information but we're not presenting it in a way that sticks. But the bottom line is 50% of new mothers surveyed can't recall having had the conversation about the safest place for their baby to be sleeping.
And one of the most important things that you can do.
Exactly. Every new parent is counseled about don't shake your baby, don't lose your cool and take it out on your baby. Every new parent is counseled about how do you install a car seat in your car properly so your baby doesn't die in a car crash. I do autopsies on far more babies who die in unsafe sleep environments than I do who've been abused or died in car crashes. So clearly we need to get the word out about what constitutes a safe sleep environment for your baby.
Yeah. Well, and this is the place where the pediatricians and general practitioners, family medicine docs need to do it. Do you take some time to educate other physicians, other care providers about these kinds of things?
Yes, I do. Whenever I get the chance, I will go out and speak to primary care practitioners, and that includes nurse practitioners around the state. Back in 2007, our state organization of coroners and medical examiners wrote a letter to all primary care physicians in the state of Minnesota talking about infant death and asking them to make sure that counseling parents about a safe sleep environment was part of the information they were providing to new parents.
Mm-hmm. And what are you doing within your own specialty group about all the medical examiners to make sure that you do things throughout the state and throughout the country in exactly the same way so our data are much more comparable?
Right, so at the national level, what we really want to do, of course, is make sure that we set some standards that all coroners and medical examiners' offices are living up to, so that we're all collecting at a minimum the same set of data. We're all going out and doing investigations at a certain baseline level so that we can start comparing things in a meaningful way and not looking at SIDS rates that vary wildly from one jurisdiction to another. Now, some of this will require some legislative and financial support because there's certainly underfunded medical examiners and coroners' offices out there that need more investigative staff if they're going to be able to do this. And we certainly need the cooperation of law enforcement as well, because in rural parts of many states, you know, the reach of the medical examiner's office is only so far. And so we work with police officers and sheriff's deputies, so on that very rare occasion when they have an infant death in their community, they know the right questions to ask the parents. They can even do the doll scene reenactment and document it for the medical examiner's office.
Right, good. Well, this time has gone very quickly. There's a lot of great information. Andrew, thank you for being with us. I think our audience has learned a lot from this.
My pleasure.
Thanks
Thank
for being
you.
here. And I'll be back with a closing comment right after this message.
Looking for these? You drive buzzed. It could be one very expensive ride.
First, you gotta make bail. Then pay me to get your car back.
Your insurance premiums will go through the roof.
And my legal fees just keep adding up. All told, it could end up costing you $10,000.
Buzzed, busted, and broke. Because buzz driving is drunk driving.
One of the main indicators of the overall health of a community is the infant mortality rate, the number of babies who die in the first year of life compared to the total number of live births. In Minnesota, the infant mortality rate had been steadily declining until 2003, when the trend began to reverse. For much of the last decade, the infant mortality rate in Minnesota actually increased, while the national rate continued to improve. This change has not generated much attention. It is a dramatic change that should raise questions about the future health of our state. As we look closer at infant deaths, it becomes evident that most infant deaths are not because of the lack of medical care or poor medical care. In fact, Minnesota's healthcare system provides some of the best perinatal and infant care in the world. It's becoming increasingly clear that the factors most affecting the infant deaths in our state are what we are calling social determinants of health: the economic, behavioral, educational, environmental, and policy issues that impact health. We are discovering that infant health is negatively influenced by poverty, poor education, unstable housing, unsafe neighborhoods, alcohol, tobacco, and other drugs, and environmental quality, among other social factors like discrimination and segregation. What this means is that if we are going to improve the health of our infants, we must effectively deal with the social determinants of health. Because these determinants are not solely medical, although medical care is one of the social determinants, infant mortality cannot be improved by the medical care system alone. It'll require attention by all of us in every sector of our society. It'll require the business community, housing and transportation agencies, educational systems, neighborhood associations, faith communities, and many more working collaboratively to assure that all parts of our socioeconomic system are focused on improving the welfare of children and families. It may be an overused phrase, but it is true. It does take a village to raise a healthy child. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.